Welcome back. So this is a video. As I told earlier, we had a poll and we have decided that we'll be doing CNS. So maximum of you wanted CNS, so I'll be discussing CNS. So this is more of a study with me video where I have my notes bundle with me and I'll be reading along and you can listen along. So let's go to the slide show from start. So this is pharmacology, CNS. Okay, so in CNS we'll be looking at sedative and hypnotics. So under that, an important category, so as I told earlier, we'll be dealing with sedatives and hypnotics. Okay, under this sedatives and hypnotics, an important topic is BZD, commonly known as benzodiazepine. Okay, so just knowing benzodiazepine is not enough, and most of us will be knowing, but still I'll be recapping. So you have a popular 3 C's in benzodiazepines. So they include clonazepam. It also includes clobazam, and also chlordiazepoxide. Okay, there are 3 C's which need to be remembered. So as soon as the word benzodiazepine strikes your mind, just remember that there are 3 C's. Just read this a couple of times and it's going to be registered. Clonazepam, clobazepam, chlordiazepoxide. Clonazepam, clobazepam and chlordiazepoxide. Okay. Then moving ahead, we have also the famous ones, that is diazepam, lorazepam. So it is very important to know not just the headings but the important drugs under this. There's also MAT, another mnemonic, which comes under this. So benzodiazepines, just know there's a DL, D and L. I remember it as driving license. So D and L, you have diazepam, and then along with that you have L, that is nothing but lorazepam. So we looked at 3 C's: clonazepam, clobazam and chlordiazepoxide, and also the D and the L. So this is diazepam and lorazepam. Then I also told there's something called MAT, which includes midazolam, alprazolam and also triazolam. So this is midazolam, alprazolam and triazolam. Okay, so Alp, that's how I remember, Alps. Okay, there are 3 mountains, so triazolam and then midazolam. You're focusing on this. So nothing but alprazolam, triazolam and midazolam. Okay, so it's over. So without any much effort, we have just memorized 3 and just 8. Just now we just memorized 8, so it's good enough. So now looking at benzodiazepines, okay, I'll also be touching on barbiturates, just a short classification. So you might be wondering why am I repeating this, but it's very important that we repeat it multiple times. Even if you ask the professors, they might forget all the drugs. They might be knowing the important ones, but they might forget the most of the other ones. So looking at long acting, there is most important. So in case of barbitone, we need to know that the drug also ends with barbiton. In case of barbiturate, it ends with barbiton. So here we have phenobarbital. Okay, and this is nothing but long acting. So in case you have no idea of CNS and you are watching this video, it would be very helpful, because at the end of the video I am pretty sure that you will be knowing at least 50% of what I am telling. So long acting is phenobarbital. Then moving on to short acting. Okay, so we saw long acting is phenobarbital. Now moving on to short acting, there is pentobarbital. So pent, so 5 sides. That's why I just drew this diagram so that it's very easy. So there's a S here. So this refers short. So while seeing this image, this registers in your head that it's S inside a house. So this is a 5-sided structure. So pentobarbital will be a short acting drug. So you'll never forget this. Next, moving on to ultra short acting. So we saw long acting. So what is it? It is phenobarbital. Now moving on to short acting. What is it? It is nothing but pentobarbital. Now looking at ultra short acting. What are the ultra short acting? So here we saw pentobarbital. So we have another pent coming here, that is nothing but thiopental. Okay, and other drug that comes along is methotrexate. So just know that, just remember the number 56. So someone tells you ultra short acting, just remember it as 0.5. This is how I remember. It might be different, but this is how I remember. 0.56 seconds. Ultra short acting. So it acts in 0.56 seconds. So what does this 5 stands for? This 5 stands for pent. Okay, the thiopental. Then 6, what does it stand for? It's something with hex. So methotrexate. So let me just recap this page. So as we all know, we have just discussed benzodiazepine. So I have told you 8 examples which you can easily recollect now. So there are 3 C's which I discussed. There is clonazepam, clobazam and chlordiazoxide. Let me repeat again for you. Clonazepam, clobazam and chlordiazoxide. Okay, so these 3 drugs have been memorized by you. And then we have the DL, the famous ones. So there is PAM, there is diazepam and lorazepam. Okay, so the driving license mnemonic is done. And then we have a MAT. Okay, so what is this MAT? It is nothing but, as I told, just remember this diagram. Alps. So you have mountains, that is alprazolam. Then you have 3 of them, that is nothing but triazolam. And you're focusing on the middle one, that is midazolam. So it's done. So we have memorized midazolam, alprazolam and triazolam. And we have also memorized the 3 C's, that is clonazepam, clobazam and chlordiazoxide. This you should be memorizing like 1, 2, 3. With practice we know 2 comes after 1 and 3 comes after 2. The same way, just repeat these 3 C's often and you're going to remember clonazepam, clobazam and chlordiazoxide. Okay, then DL, diazepam and lorazepam. Now this is done. Now moving ahead with the barbiturate classification. So in this video I am going with a slow pace, so that there's a misconception that the faster you read the more you cover. But in case of pharmacology, the slower you go the better it is, because it does not matter how well you remember in maybe 1 or 2 days, but it's more important that we remember the content for a longer period of time and throughout our practice. That's why it's best to go slow in case of pharmacology. So now we have read benzodiazepine. So this is done. So even if I ask you now, you're going to be telling me 8 examples without even looking at it. Okay. So I'm not looking at it. I can tell you again. It's clonazepam, clobazam, chlordiazoxide, then DL, that is driving license. You have diazepam, lorazepam, and then you have the 3 mountain structure that I drew, that is alprazolam, midazolam, and triazolam. So we just easily memorized the 8 names under benzodiazepines. Now we'll be looking at barbiturates. So what are these barbiturates? So now looking at this, there is long acting, which I told is the famous one, that is phenobarbital. Then there's also a short acting one, that is pentobarbital, and entobarbital. I told you a structure which is easy. There's a pentagon with an S in it, so you have pentobarbital. So it's done. And in case of ultra short acting, I just told you an example of 0.56 seconds. So that 5 is nothing but thiopenton, and this 6 is nothing but methohexiton. Just a second. Okay, so hopefully now this examples stick in your head throughout your studying. So now what do I do? Okay, it changes, is it? How do I erase this? 1 second. Go back. Okay. I want to keep the ink, discard. I don't know. Okay, maybe. Oh my god, wait, did that delete? It's okay. I'll be recapping it again. So let me go from start. Wait, done. Okay, so it might be a repetition again. So benzodiazepines, this time a bit fast. The benzodiazepine is divided into the 3 C's that I mentioned, that is clonazepam, clobazepam, and chlorperoxide. And then you have D and L, that is driving license, diazepam, lorazepam, and then you have the 3 mountain structures, that is alprazolam, midazolam, and triazolam. So easily we have finished the 8 examples. So this 3 I'll be repeating. It is clonazepam, nazepam, okay, then clobazam, okay, and then chlordiazoxide. Come again, clonazepam, clobazam, and chlordiazoxide. Diazoxide actually, P, okay. So it's done. So you have a chlorine, so chlorperoxide, and what is this? Clonazepam, and then cloboxam, and then clobazam, right? Yeah, done. Now, looking at the barbiturates, we learned long, short, and ultra short. Now looking at long, let me think, what was it? It was pentobarbital, and this is just, I'm recollecting without looking at the content. So now short acting, what did I tell? I just remember this structure, but now I have to think what the structure meant. So it is nothing but pentobarbital. This is how anyone remembers. Just make some connections and it's easy, very easy. Ultra short acting is nothing but, it is, wait, let me see, I did 0.5 seconds. So what is it? What acts in 0.5 seconds? It's penton. So there's a pent and there's something before it, so it's thiopenton. Done. So thiopenton is done. And then looking at, there's a 6, and I remember a methane group attached to it, so it's methexiton. It's also done. Great. So now we have just finished with the classification. Now moving ahead with what is this benzodiazepine. As you know, it's benzo. So what is benzo? It is nothing but a benzene ring, right? Okay. Now it is fused to a diazepine ring. So it is nothing but benzodiazepine, right? With me? Good. So now looking at the site of action, where does this act? It acts on the, you can say, midbrain and also the limbic system. So as you know, it's a CNS drug, so now it will just act on the midbrain and the limbic system. Okay, so now just move. This should not get deleted. Okay, so now mechanism, MOA in short. This always refers to mechanism of action. So now we have BZP, that is nothing but benzodiazepine. So what it does is it acts on the GABA receptors. So here I am drawing the GABA. Right? With me? Good. So it acts on the GABA receptors. And then what it does is it increases the frequency of opening of calcium chloride. So it opens, it closes, it opens, it closes. So this thing, it happens very frequently, quick, very quick. Okay, very quick, very quick. Okay, so what happens is the frequency is nothing but there's a increase and decrease. I mean, it's opening and closing in a very short interval. So frequency of opening of chloride channel is more. So let's draw chloride here. So yes, we have done with chloride, and then the frequency of opening of chloride is increased. Now moving ahead with chloride, chloride opens, and then there's increase in GABA mediated chloride channel, and then what happens is there is hyperpolarization. Did you hear me? It is nothing but hyperpolarization. Okay, and this remember it's hyperpolarization, hyperactive, hyperpolarization, and this membrane hyperpolarization leads to CNS depression. Are you with me? Good. And looking at the common uses, where is this used? So as we know, it is CNS depression. So just by knowing CNS depression, what can we imagine? We can imagine a patient who is very hyperactive, and you can just think of administering it to him so that he calms down. He is not in his hyper state. So now keeping that example in mind, so we have a kid who's very hyper. Okay, he's very hyper, like what is happening, okay, he's very hyper. So now keeping this hyper kid in mind, so we can tell he's good for sedation, we can use for hypnosis also, and we can use as an anticonvulsant. You can use it also in operative procedures. Okay, minor operative procedures. Anxiety, and also in muscle relaxant. Alcohol withdrawal, and also there's something called conscious sedation. Now going back to where I started, so we learned about the uses, that is nothing but sedation and hypnosis. So now looking at sedation and hypnosis, what it does is it decreases the time required to sleep. This is nothing but sleep latency. So when you look at the sleep, as we all know, theoretically there is REM sleep and NREM sleep. So in case of the NREM sleep, what is happening is that all stages are shortened and the stage 2 is prolonged. So this needs to be known, that all stages of NREM sleep are shortened, whereas the stage 2 is being prolonged. Okay, this is of the NREM sleep, right? Okay, so comparing the benzodiazepines and the barbiturates, so which one do you think should be preferred? Yes, if you're thinking benzodiazepines, it is absolutely right. So they have a wide therapeutic index, so increase in therapeutic index. And then looking at the normal sleep, they have a near normal sleep, and the rebound phenomenon is very less on withdrawal. And looking at the minimal, the hangover effects is also very minimal, and the respiratory depression that is seen is also very minimal. And looking at the tolerance and dependence is also very less, and there's no enzyme inducing property. So wait, I'm just telling it, so I'll just write it and make it very easy for you. Okay, so now an important aspect is comparing benzodiazepines with the barbiturates. Okay, now before going ahead, I just want you to recollect the classification I told you. Do you still remember it, or have you forgotten? Quickly, the 3 C's: clonazepam, clobazepam, and chlordiazoxide, and then DL, that is diazepam, lorazepam, and then the mountain structure: midazolam, alprazolam, triazolam. That's MAT. Done. And then barbiturates, as I told you, there's long acting, short acting, and ultra short acting. Long acting, there's phenobarbital; short acting, pentobarbital; ultra short acting, pentobarbital. That's the structure with the pentagon with an S. So it's pentobarbital. And ultra short acting, there's nothing but 0.56 seconds. That's the mnemonic. So there's thiopenton and then methohexiton. That's a 6 with a methane ring. That is methohexiton. So let me just quickly write long, short, and ultra short. So here you have phenobarbital, and here you have pentobarbital, and here you have thiopenton and methohexiton. So in case you're sitting with the book and trying to memorize everything, it is very tough. So it's always better to create associations and constantly revise. So I just went to this page, but still I'm just going back just to recap so that I can recollect whatever I've studied. Otherwise, studying for hours and hours is of no use. So as you keep studying, it's better to go back and revise what you have read before. So now, looking at comparing benzodiazepine, as I told earlier, it's benzodiazepine along with what? So, or as I told you, I was comparing benzodiazepine along with the barbiturates. So, as a doctor, which one do you prefer? So, which one is preferred? So, it's obviously benzodiazepines, BZD. Okay, BZD or BZD. So, the benzodiazepine is preferred. But why? Looking at, firstly, we'll be looking at the therapeutic index. So, it has a huge, wide therapeutic index. So, why is any drug preferred? The main reason would be therapeutic index. So it has a wide therapeutic index. Now looking at the sleep, it has a near normal sleep. Okay. So there is, the sleep disturbance is not often seen. So you can say the sleep. So let's put a diagram of a person sleeping. So sleep is not disturbed mostly. So it's normal sleep, and there's less rebound phenomenon. So there's less rebound phenomenon. Okay, this is a basketball. So just to remember this rebound phenomenon. So you see a person sleeping and there's a basketball, so there's less rebound phenomenon. Okay, and then moving on to the hangover is also less. Okay, and then the respiratory depression is also less. So we can relate two things. Two things are less. That is, there's less of respiratory depression and there's less hangover effects. Okay, and then moving on, it has a good tolerance and dependence, in the sense they are on short period. When they are used, it does not develop tolerance and drug dependence. Okay, so I would suggest you correlate with this point. So it has a wide therapeutic index, and along with that you can relate to the tolerance and dependence. That is, in case of short doses, they are less likely to cause the tolerance and dependence. So that is over. And then moving ahead with what was left. So this is done. And then in case of the overdose of these benzodiazepine overdose, so we'll look at B, Z and D. Overdose. So in case of this B, Z and D overdose, what do we have? So looking at this, we have some antagonist which can be used. That is nothing but flumazole. That is used. One second, having water. So flumazole is done. Okay, so flumazole is used as a overdose in case of overdose. So now just recapping, what did we discuss? Why is benzodiazepine? So even without even looking at the video, you need to be telling me what are these. So it's simple. They have a wide therapeutic index. Let me just, okay. So why benzodiazepine? Firstly, they have a wide TI, that is nothing but therapeutic index. Now moving second, what did I tell you along with TI? I told you about drug dependence and tolerance. So in short doses, it does not develop drug dependence and tolerance. Okay, tolerance and dependence. So we clubbed the 2 points, and then again I put 2 similar points. That is decrease in what? I put a man sleeping, so it decreases sleep. Wait, it does not decrease sleep. Wait, what were the 2 points? I had related respiratory depression, right? So decreases respiratory depression, chances of respiratory depression, and also it decreases abnormal sleep. So the sleep what you see is normal. So in this case, I had earlier related with the tolerance. So the respiratory depression is also less, and also the tolerance and dependence is also less in case of short doses. So here the sleeping person, right? So that was nothing but there is normal sleep. So there is mostly normal sleep, and the basketball which I drew, if you can recollect, is nothing but the rebound phenomenon. So in case you're reading only text, it's going to be boring. So you need to always relate yourself with some real life examples. So now again, so this is done. So in case you're giving, there's going to be an overdose in the treatment. So what will you do? So in any overdose, we know that we need to give something else which can act on this and will make it better. So that is nothing but the antagonist. So you're giving a drug A and it is acting, then you give drug B to reduce it. So that is nothing but antagonist, and in this case you have a drug called flumazole. Okay, flumazanil. So this flumazanil can be used, and it also, there's another enzyme property, that there is no enzyme property and drug interaction is less. Now let me just recap. See, it's better we club the 3 points together. Okay, so we have a wide therapeutic index of benzodiazepine. So in case of wide therapeutic index, so it should always be connected. Just link it like a train. 1, 2, 3. So when you think of the point, you will be obviously all the 3 points will come to your mind. So what was it? So I told you they have wide therapeutic index, and then I told something about that same T, that is tolerance and dependence. Done. And then I am talking about something else also, that is nothing but drug interaction is less. And this comes under what? Drug interaction was less, right? So that is there. Drug interaction, yes. And then moving on, we discussed something is less. There is nothing but respiratory depression is also not affected, so it is less. Okay, now moving ahead, we drew a basketball, right? And the rebound. So looking at the rebound, we can say the rebound phenomenon is less. Okay, and this is nothing but causes near sleep also. So near sleep is not disturbed. Okay, and as earlier I told about NREM and REM sleep. Yes, so REM, what I told was all stages are decreased, whereas in case of stage 2 is prolonged. This needs to be known. Stage 2 of an NREM sleep is prolonged. Okay, so that's it. Now we'll be looking at the uses. I'll be finishing this topic of, it'll take a few more minutes and I'll just finish it off. Okay, so where were we? Yes, so benzodiazepine, sedation and hypnosis we finished, and we'll be discussing some other causes also a bit. So the anticonvulsant effect, as you see. Okay, so it is brought by diazepam, lorazepam, clonazepam, clobazepam. So the drugs, you remember, everything is used in anticonvulsant. And in the case of these famous drugs, the diazepam and lorazepam, that's the driving license, what I told about. So this is used to control the life-threatening seizures. Okay, life-threatening seizures in status epilepticus. And clonazepam is used in treatment of absence seizures as well. Okay, so let's do it again. See, this diazepam, lorazepam is used in life-threatening seizures and can also be used in case of drug-induced convulsions, febrile convulsions, in tetanus. So there are a wide variety of diseases. So these drugs, that is diazepam, lorazepam, can be used in case of tetanus also. Okay, and can be used in case of life-threatening seizures. Moving ahead, this clonazepam is used in absence seizures. Clone or clown. So clonazepam. Okay, done. So we finished that. Now diagnostic and minor procedures are used in. Okay, so we also know that, as mentioned earlier, minor surgical procedures it can be used. Okay, and also in endoscopies, it's minor surgical procedures, and also it is used in case of pre-anesthetic medication, as we all know. And why is it used in case of pre-anesthetic medication and general anesthesia? It is mainly because just so that the patient, he forgets the perioperative events that are taking place after the operation is over. So in that case, this is used. And then looking at the anti-anxiety effect, also it is used here. So there is some benzodiazepines, the diazepam, oxazepam, alprazolam, lorazepam, chlordiazoxide, everything are used. Okay, so that is also done. So how does this act? In case of anti-anxiety, it is very important to know it acts on the limbic system, directly on the limbic system. So in case suddenly I ask you, tell me something about the anti-anxiety effect of the benzodiazepine, the first point that should click is they act on the limbic system. So anti-anxiety property of benzodiazepine, yes, it acts on the limbic system. Yes, so that's how you need to connect. So that is done. And then we have the muscle relaxant property. That is, as we know, it reduces the tone of the muscles by inhibiting the polysynaptic reflex in the spinal cord. Okay, so that is done. So muscle relaxant, so as I told, what does it do? It inhibits the polysynaptic reflex of the spinal cord. Inhibits, this is a symbol for inhibits, minus and a circle. Inhibits polysynaptic reflex of the spinal cord, in the spinal cord. Do not worry, I'll be repeating again. And then also to treat in case of alcohol withdrawal. Do not worry, I'll be organizing it again. So this here, chlor diazoxide and diazepam are used. So now let me just quickly recap. So we will be recapping again. So in case of sedation, we know why benzodiazepine is used. Why? I told you the 3 trains. So connect it. So I will talk about therapeutic index. It has a wide range of therapeutic index. Then what is the next? Which is the T, tolerance and dependence. Yes, it has a good tolerance and dependence. Now moving on to the next vehicle. That is nothing but what was it? It was it the drug interaction? Yes, it was the drug interaction. See, everything is related. See, TI, therapeutic index, wide. Same T, you have the, what is that? That is tolerance and dependence. Yes, it is more. And DI, the same D, you continue with it. Drug interaction is minimal. And we saw there's decrease in respiratory depression. That is done. So we have easily memorized 4. Now moving ahead, there should be an antagonist. Put this minus with a circle. Okay. So there is an antagonist. What is that antagonist? It is nothing but flumazenil is the antagonist. Okay. So that is also done. Okay. So this is completely done. Okay. And that's all. And moving on to the anticonvulsant, as told. I have told you the famous drugs as diazepam, lorazepam. It can be used in case of tetanus. It can be used in case of emergency. What emergency? It life-threatening seizures in case of status epilepticus. Life-threatening seizures. Now moving ahead, what are they used for? There is, I told about procedures, right? Operative procedures. So you can use in case of endoscopies. That is done. And then important, it is used in case of, as you know, in minor operative surgeries, procedures. Okay, so that is nothing but it can be used as pre-anesthetic medication and general anesthesia. So in case of that, we have discussed, yes, so the perioperative events that occur are usually forgotten after the operation. So in case of next is anti-anxiety effect. So in that also these drugs are used, as I told you, anti-anxiety. So can you recollect what I told you earlier? So anti-anxiety means what? Yes, it is the limbic system that needs to be remembered. So anti-anxiety property is nothing but the limbic system it is acting on. Then also muscle relaxant. So the point here is you don't have to remember all the points I'm telling you, but you just need to remember that all the points, it belongs to this class of uses. So in case of muscle relaxants, they reduce the skeletal muscle tone by inhibiting the polysynaptic reflex in spinal cord. That is told. So it inhibits the reflex in the spinal cord, polysynaptic reflex in the spinal cord. Okay. So that's how it acts on the muscle relaxant. So this relaxant effect of benzodiazepine, where is it used? It's used in case of spinal injuries, in tetanus. So this is an important point which should be focused on. Muscle relaxants. So looking at muscle relaxants, it's saying that it reduces the skeletal muscles. Skeletal muscle tone is reduced. Okay, this is what is being discussed here. So they're telling that the skeletal muscle tone is being reduced. Okay, by inhibiting the reflex in the spinal cord. Okay, I get that. But where is it used? It is used in case of spinal injuries. So can I recollect how the spine looks? Okay, so spine injuries. Okay, so spine injuries is done. Now moving ahead, we have already seen what a spine injury is. We finished. Now moving ahead, we'll be looking at tetanus. Yes, we already discussed tetanus in few points ahead. That is diazepam, lorazepam is used in case of tetanus, and then what is the other one? Tetanus, then life-threatening seizures, and drug-induced convulsions, febrile convulsions. Okay, so that was done. So same thing, it is used in case of spinal injuries, tetanus, spinal injuries, already mentioned here, and also cerebral palsy. Cerebral palsy, very important. Just read through it. And that is all. And also used in case of alcohol withdrawal. Okay. So this is alcohol withdrawal, and in this withdrawal we know that most commonly used drug are nothing but chlor. What is the chlor we are talking about? Chlor diazoxide and diazepam. So now if I'm asking you a question, what are the 3 C's I discussed? So you need to be quick. It is nothing but clonazepam. I drew the clown before. Clonazepam. Then clobazam, clonazepam, and then chlordiazoxide. Okay, the 3 C's which you know. Then moving ahead, diazepam. Then also conscious sedation. Okay, done. Now let's move. Now looking at pharmacokinetics, is it important? No, it is mostly the same. For most of the drugs it is the same. All the drugs, almost all the drugs metabolized in liver, excreted in the urine. Okay, urine. So this is very common in almost all cases. Okay, and other thing we need to know that the IM route is not preferred in case of the benzodiazepine. Why? Because it's erratic absorption. Okay, because it reacts violently basically. So we don't use. So the absorption is not as expected. So that is the reason. Then moving ahead, what are the other points? So looking elimination, metabolized in liver, yes, metabolized in, okay. So other thing is this benzodiazepine is able to cross the placental barrier. So that needs to be known. Okay. So there are few points that needs to be known. So it is given IM. It is not given IM. Should not be given IM because of its erratic absorption. And then as we all know, most of the drugs is metabolized in the liver and is excreted in the urine. So this needs to be known. And then looking at the placenta part, it crosses the placental barrier. So in case of pharmacokinetics, I told these 3 points which needs to be remembered. First is the diagram of the liver that is metabolized and then excreted. Then IM is not used, and then benzodiazepine, it crosses the placental barrier. That's all. Now looking at the adverse effects, what does it do? So as discussed earlier, it has a very wide range of property. Okay, that is safety margin is there. Now moving ahead, we have done that. Now looking at the adverse effects, so mainly it is used compared to the barbiturates. That's what was discussed. So we can look at the other side effects which can also be seen. Okay, so in this case, what are the side effects? So the side effects can include, let me tell you. So looking at the side effects, there is drowsiness, confusion, blurred vision. Okay, first let me draw an eye. So this is the eye. Okay, so you have blurred vision. So the vision is blurred. Okay, this is one side effect. Then you have all the CNS manifestation, basically the drowsiness, confusion. So there's a guy who's telling I'm dizzy. I am dizzy. So this guy, if you look at him, you can describe him in several adjectives what you want. So you can tell drowsiness, confusion, disorientation. Okay. And in case of short amounts, I told you tolerance and dependence is less. Okay, it becomes more tolerant and dependent as the drug is given in short. And as the drug is increased in large amounts, as told, it is more tolerant and okay. Next, moving on to the other effects, you can also, so in case you give a drug, any drug, you need to know that if you stop administering the drug, you are going to have several side effects. So this is nothing but the withdrawal symptoms. So in this case of these benzodiazepine, so this withdrawal symptoms, what is caused is there is restlessness, tremor, insomnia, restlessness. So just remember what is restlessness. Restlessness is basically you don't know what to do, you're hyper. Okay, so there is nothing but restlessness. So obviously in case if you're restless, you obviously cannot sleep. So along with that, there's insomnia. Okay, so that is also there. So there's insomnia as well. Now I told you there's restlessness, insomnia. So you can accompany this with tremors as well. There are tremors. And then you can say since his restlessness, insomnia, he can be nervous also. So it's easy to remember all this. Then moving on, in case of benzodiazepines, in case of labor, okay, benzodiazepines, if you use it in labor, what happens is the respiratory depression and hypertonia is caused. So in case of, let me move, okay, benzodiazepine, in case of labor, what happens? So what happens is there is respiratory depression. I earlier told that there is less respiratory depression in case of benzodiazepines and in case of barbiturates. So yes, that is there, but in case of respiratory, in labor, there is causes respiratory depression. Okay, this needs to be known. And it also results in hypertonia in case of newborn. Okay, that is done. And that is nothing but floppy baby syndrome. So just remember a floppy disk. I used to use it long back. I mean, I didn't use it, but I've seen it. So it looks something like this. And there's a baby. Okay, so we can say it's nothing but floppy baby syndrome. Done. In some patients, these drugs may produce paradoxical effects such as convulsions and anxiety. Okay, so that is done. Now, if you're looking individually at a drug, the most important is diazepam. So let me give a few points about it. So it is given IV or IM, can also be given, or also rectal. Okay, as mentioned earlier, IM you need to be careful and the absorption is erratic. So now moving ahead, some important points I would like to discuss of diazepam. So what are the points related to the diazepam? So it is rapidly absorbed in the gastrointestinal tract and it produces active metabolites. Okay, so this is nothing but a pro-type drug. So this needs to be known that this is nothing but diazepam is nothing but a pro-type drug. And now looking at the important points, there's rapidly absorbed from the GIT. Absorbed rapidly, okay? So it's absorbed rapidly and produces active metabolites are produced. Done? Are you with me? Yes. So now, okay, and the reducer effect is also very less, and it can be rectally given also, used rectally to control convulsions. So in case of convulsions, we need to know it can be given rectally. Okay, so it is absorbed rapidly in the GIT, okay, and then it is produces active metabolites, and it can be given rectally in case of controlling convulsions. So that is done. So now I'll be just covering the benzodiazepines and diazepam, and this will be a bit quicker because we know most of the general uses. So what do I do? How do I go next slide? Keep. Okay, so now I'm smart enough, I just kept the slide. So now, whoa, we just finished so many slides, is it? Okay, now we'll just go ahead with the insert. I want a new slide. Okay, this is the slide. Okay, so now what do I do? Slideshow? No, let me insert more slides. New slide. Okay, so now let me go in. So slideshow from current, yes. So now I need water is empty. Okay, and now we'll be looking at barbiturates. Okay, barbiturates. So first thing you need to know that I had discussed barbiturates earlier. So what was the points that I discussed? Why not use barbiturates? So it's just a recap again. So in case you're with me, I'm very confident and sure that you will be remembering almost everything I'm telling, because I'm always recapping and interlinking them. So barbiturates, it is not used. Why is it not used? You need to interact and tell me that why is it not used. You need to keep thinking. So in case I'm asking a question, you need to be ready with the answer. So why barbiturates are not used? So do you remember the train I drew? First thing is therapeutic index was more, and then TI, and then there was another character. There was drug interactions here, and then there was tolerance and dependence. So easily I just memorized. So then you have respiratory depression, it decreases. So this is done. And there was another point. What was it? That is there is an antagonist effect. So here antagonist. So flumazenil, right? Yeah, I'm right. Flumazenil was the thing it was used. So we finished barbiturates, right? Okay, so this is why it should not be used, but still we just have to know a bit of it. So the mechanism of action is similar. So barbiturates, it binds to the GABA A receptor. Same thing, GABA A receptor. So here what it happens is the duration of calcium channel kept open is increased. So same thing. So similar mechanism of action, it causes hyperpolarization and CNS depression. So here it's hyper. There also it's hyper. So just remember, in case there's a mechanism of action of benzodiazepine and barbiturates asked, we need to know that there is CNS depression, and CNS depression is a result of hyperpolarization of the membrane. So that's how it came. Now, looking at some of the uses, as mentioned earlier, it is used in case of sedation and hypnosis, general anesthesia, anticonvulsant. Okay, so let me write the common things. That is sedation, hypnosis, okay, done. And then there is also general anesthesia, okay, and anticonvulsant. And looking at jaundice, there's neonatal jaundice, okay, done. And also there is, yeah, so this is a new add-on, and it's very important to know this. Neonatal jaundice, okay, of non-hemolytic type. So this is an important use that was not seen earlier in case of benzodiazepines. So what is this? This is neonatal jaundice of non-hemolytic type. So you have this phenobarbital may be used to reduce the serum bilirubin levels. Okay, so you have this phenobarbital. Okay, so there's something called phenobarbital. So this phenobarbital is used to reduce serum bilirubin level. Okay, so what is this? It is nothing but the phenobarbital, which is used to reduce the serum bilirubin level. Okay, and it induces the gluconyl transferase enzymes and hastens the metabolism of bilirubin. Okay, so now going ahead, what was I telling? So we talked about phenobarbital. So this phenobarbital may be used to reduce the serum bilirubin level. Okay, it induces this enzyme and hastens the metabolism of bilirubin. Let me just write it. So phenobarbital reduces the serum bilirubin level by increasing the metabolism of bilirubin. Hastens the metabolism of bilirubin. And this is by induction of gluconyl transferase enzyme. GT. All of you will be knowing what is GT. So it's easier to memorize. Gluconyl transferase. It's a famous game. So it's gluconyl transferase. Okay, so hastens metabolism of, so I'll draw a car here in case you remember. Okay, going very fast. This is nothing but GT. So gluconyl transferase. This is in case of barbiturates. So just imagine a Barbie going here. So this is how you remember. So you can see a Barbie going in the car. So this is nothing but GT. GT is gluconyl transferase. Gluconyl transferase is induced, okay, and the metabolism of bilirubin is hastened. Okay, so this results in reduction in bilirubin. Done. So this is how you relate everything. So adverse effects is common as always. You can just add on to all the adjectives. So you have drowsiness, confusion, headache, ataxia, respiratory depression. Okay, then you have also hypersensitivity reaction. This can happen in most of the drugs in case you're hypersensitive. So you have skin rashes, itching, swelling, and tolerance, you can tell. So it's almost the same. So adverse effects are almost the same. So that's it. Wait, precipitate acute intermediate porphyria by inhibition of ALA synthase and catalase. Okay, so this is also important, that the precipitation, it precipitates attacks of acute intermittent porphyria. Okay, so increases the chances of acute intermittent AIP. Okay, this is important to know. So this barbiturates, it acts on AIP, that is acute intermittent porphyria. Got it? Yes. And by inducing ALA synthase and catalase, and that catalases the production of porphyrins. Okay, by inducing ALA synthase, that catalyzes that catalyzes the production of porphyrins. Got it? Next, moving on, we have the treatment of acute barbiturate poisoning. It's almost an hour since I spoke, right? So this has been continuously, I'm just recording. So acute barbiturate poisoning. So in case of acute barbiturate poisoning, what should be done? So in case of poisoning, first thing is ABC, that is you look for the airway, breathing and the circulation. This is the basic thing that needs to be done. Airway, breathing, circulation. So in case a patient is not feeling well, first thing to look for is airway, ABC. This is the ABC of medicine. That is airway, breathing and circulation. Very important. Then also electrolyte balance should be seen. Then it's obvious gastric lavage can be done, and also alkaline diuresis should be done, and hemodialysis can be done in case of, so you can do hemodialysis in case of what? Severe cases only. Done. Okay, so where was I? Adverse effects, common side effects. Okay, so we have discussed it. So in case of acute barbiturate poisoning, same thing, you'll have drowsiness, restlessness, drowsy, restless, hallucination, hypotension. Okay, and then there was also that there is a chance of increase in AIP, that should be known. So it induces ALA synthase. ALA synthase is induced. So this ALA synthase is induced that catalyzes the production of porphyrins. Okay. So it induces ALA synthase that catalyzes the production of porphyrins. Okay. So just remember that. And it induces ALA synthase that catalyzes the production of porphyrins. Done. Okay, now looking at what else is there? No, I'll just leave you with this. So drug interactions. What is there in drug interaction? Barbiturates are potent inducers. Okay, and reduce the effect of co-administered. Okay, this doesn't look that important. Okay, you can tell that it interacts with the drugs such as oral contraceptives. So you can say it can interact with oral contraceptives, oral anticoagulants, and also oral hypoglycemics. So what does it interact with? So in case if I tell you what does barbiturate interact with, three things should come to your mind. That is the OCs, OA, all are oral. So oral contraceptives, oral anticoagulant, oral hypoglycemic. So these 3 points should be known. Let me repeat: oral contraceptive, oral anti-epileptic, oral anticoagulant, and oral hypoglycemic. Hack. Hypoglycemic. C for clotting. Clotting, coagulation, right? Coagulant. A for what? Anticoagulant. This C is not for coagulant, it's for contraceptives. Hypoglycemic, contraceptive, and anticoagulant. Okay, that is done. Now looking at some non-benzodiazepine hypnotics. This is also an important topic that needs to be covered. I am unsure whether I mentioned at the start, so I'll be repeating again, or in case I am not, this is the first time I'll be repeating. Non-benzodiazepine. So this is a very important topic. Okay, it's non-benzodiazepine. So here you have 3 Z's. What is it? It is zolpidem. Got it? And also zopiclone. So there was another clone, if I remember. What was it? That was clonazepam. So the same clone comes here. So it's zopidem and zopiclone, zaliplon. So it's more like a tongue twister. So the faster you tell it and the frequent you tell it, it's going to register in your mind. So all the Z's comes here. Non-benzodiazepine hypnotics. Zolpidem, zopiclone, zaliplon. Zolpidem, zopiclone, zaliplon. Zopidem, zopiclone, zaliplon. So zolpidem, zopiclone, zaliplon. Okay, so you have just memorized it. So now looking at the uses. Okay, so I'll just be taking the example of zolpidem. Okay, almost 1 hour, right? Okay, I'll be covering just zolpidem and finishing this video. So zolpidem is mainly, it produces hypnotic effect. Okay, so as usual, metabolized in liver, excreted in urine. Okay, now looking at the similar action, it acts on the GABA A receptor, and then GABA mediated neuronal inhibition, the same thing. CNS depression, so CNS depression is brought by the membrane hyperpolarization, same. And then orally effective and is used in short-term treatment in insomnia. Okay, that is zopiclone. Okay, so zopiclone, so this was nothing but what I discussed was zopidem. So now looking at zopiclone, okay, so it is orally effective and it is used in short-term treatment of insomnia. So you can say it is used in case of insomnia, and that too short-term. Okay, so what was it? It is used in case of short-term treatment of insomnia. So you need to know, if someone asks you where is the non-benzodiazepine hypnotics, under that are commonly used for insomnia, you can also tell zopiclone and zaleplone. So it's used in case of insomnia and produces normal sleep like benzodiazepine, and side effects you can tell the same thing. In case of zopiclone, the side effect you can see is metallic taste. This needs to be known. So in case of zopiclone, you get a metallic taste. Okay, imagine a clown carrying a metal, so you have a metallic taste. It's almost now zopiclone. Okay, so the shortest acting non-benzodiazepine hypnotic. So looking at the shortest acting, so what is the shortest acting non-benzodiazepine hypnotic? So this is zapiplon. Lone. Okay, plon. So this is zapiplon. So you can just remember on. So here there's another word which ends with one. Okay, that is nothing but zapiclone. Okay, so here on. So shortest acting on what? So shortest, you should remember it ends with on. So you have zaleplon. Okay, this is how it acts. So now it is very important that you know what I have been discussing. So now quickly recapping. So we have finished about, I believe, 1 hour, right? So I'll be just recapping the entire 1 hour in say about 2 minutes. I'll just finish it in 2 minutes. Okay, and I'm sure that if you have been listening throughout this video, you will be able to recollect each and every point I have mentioned. So don't feel that you have spent 1 hour for a small topic, but I'm sure that this 1 hour will be effective and you can recollect it over a long period of time. So we have seen benzodiazepine. So quickly tell me the mountain. So it is alprazolam, midazolam and triazolam. Okay, done. Then DL, what is DL? Diazepam, lorazepam, done. Then the 3 C's, that is clonazepam, that is clobazepam and chlor diazoxide. Okay, clonazepam, clobazepam. Okay, I'm just writing rough, so but I'm sure you will be recollecting. Then moving on to the barbiturates, we had the we had the long acting, we had the short acting, and we had the ultra short acting. Now looking at the long acting, you have the phenobarbital. Okay, that is the long acting, and looking at the short acting, there is pentobarbital. I drew a house-like structure with an S, so it's pentobarbital. Now looking at the ultra short acting, we had the thiopenton and the methohexiton. Okay, this is done. Okay, so let me recap. Long acting, there's phenobarbital, and then short acting, there's pentobarbital, that is the structure which I drew, that is S. And then the ultra short acting, I told 0.56 seconds, so there's pent, and there's this theo before it, so thiopenton. Then we have the methohexiton 6, so there's a methyl group attached to it, so there's a methohexiton. So done. So coming to the mechanism of action, it's common for almost all the drugs in case of sedative hypnotics, that is the GABA A receptor is acted on, and then it results in membrane hyperpolarization, and this membrane hyperpolarization results in the CNS depression. Are you with me? Hopefully yes. And then moving on to the uses, as mentioned, moving on to the uses, we told we can use as sedation, hypnotic, and then anticonvulsant. I'll be writing all. Okay, and then anti-anxiety. You don't have to repeat or recollect in the same order. You just need to know that these points fall under this. It can be used as muscle relaxant. So what did I tell about muscle relaxant? It's important. So it inhibits your polysynaptic reflex of the spinal cord. And where is it used? It's used in case of tetanus. It is used in case of spinal injuries. In case of cerebral palsies. Okay, done. Now also it is used in case of alcohol withdrawal. That is chlor diazoxide, and also diazepam is used. Okay, so and also endoscopic procedures as mentioned earlier, and also so that in general anesthesia, so that you forget the peri-operative events that take place. So it's done. Pharmacokinetics is easy. Liver, urine, and then it crosses the placental barrier. This is important. This is placental barrier. So are you with me? Hopefully yes. And adverse effects, you can tell the same thing, similar things, as many as you want. Drowsiness, confusion, and important, blood vision is also found. And then looking at in labor, it causes hypotension. Decrease in respiratory, causes respiratory depression. Case of labor. And I drew a floppy disk, right? So the floppy baby syndrome. So that was important. Now looking at diazepam, it is it is absorbed in GIT. It produces active metabolic. It's a pro-type drug. Right, move. So we looked at diazepam. It is nothing but a pro-type drug. Are you with me? Okay, so we have discussed it's a pro-type drug, and it can be given rectally also, in case of controlling convulsions. And another important point was I told in pharmacokinetics is it's not given IM because there's erratic absorption. Okay, now moving ahead, we have the barbiturates. So the barbiturates are non-selective CNS depressants, acts on many sites, and forgot to tell you the main site of the barbiturates. The main site of action of barbiturates is the ARAS. So what is this ARAS? ARAS is nothing but the ascending reticular activating system. Ascending reticulate activating system. So going ahead with this, we need to know where it is this. Okay, so in case someone asks you what is barbiturate, we need to know that it is ARAS, nothing but ascending reticular activating system. Okay, that is ARAS. So barbiturate acts on ARAS. Okay, then moving on, same thing, GABA A. So as far as this class was concerned, you should be knowing what is GABA A. So just remember that GABA A was there, and GABA A acts on GABA receptor, causes membrane hyperpolarization, always leads to CNS depression. These points should be known. And then also in neonatal jaundice. So I told an example, right? A car and a Barbie going in the car. So it's a GP, that is nothing but glucuronide transferase enzyme. So this is nothing but it hastens the metabolic bilirubin. Okay, and then it is used to reduce serum bilirubin levels. Reduces serum bilirubin. Okay, done. So now adverse effects, as we know, we told you that go back, keep, insert. Okay, insert new slide, slideshow, start from current. Okay, so adverse effects, we told it precipitates adverse effects. It increases chances of AIP, that is acute intermittent porphyria, by acting on some enzyme, right? Inducing the ALA synthase. So it acts on ALA synthase, and it catalyzes the production of porphyrins. So it catalyzes porphyrins. Okay, And then barbiturates are contraindicated in porphyria. Then acute intermediate porphyria. So yeah, treatment, as you know, any treatment will require ABC monitoring, that is airway, breathing and circulation. It's very important, ABC. Then gastric lavage, hemodialysis can be done in case of severe cases, hemodialysis. And alkaline diuresis can also be done. And then looking at the drug interactions, we know it's been 1 hour since I was talking. Okay, so it's been drug interactions. In drug interactions, we have told you there are 3, that is oral, that is oral contraceptives, oral anticoagulants, that is what hack, right, the mnemonic. So anticoagulants and oral contraceptives and oral hypoglycemia, so we need to know that. And then zolpidem, same principle, and then we need to know it is used in zopiclone. So these drugs are nothing but non-benzodiazepine hypnotic. So these non-benzodiazepine hypnotic are used in case of insomnia. Okay, so they're nothing but short acting. They're nothing but short term treatment in case of insomnia. Done. So what is the shortest acting non-benzodiazepine hypnotic? So the answer is zaleplon. So great. So in case you have found this class useful, the only sign I can get by the viewers is by liking the video. So that's an indication whether you want me to continue or you can manage on your own, or it would be good in case you whether you found this useful. In case you found this useful, I am very happy. So now let me go new slideshow. So we have studied. So now start from current. So now, as far as I am concerned, now in case you are able to recollect these points, it means I am successful in making you understand. So benzodiazepine, drugs, mechanism, adverse effects, pharmacokinetics, we know. Same thing applies to the barbiturates, and same thing applies to the newer acting, right, non-benzodiazepine hypnotics. So these things, if you're able to tell, it's really great. And then mechanism of action, we know it's GABA A, causes hyperpolarization of membrane. So that's done. These are done. Then other important thing I wanted you to know is some minor points which need to be known. So where are they? Here is nothing. So yeah, with benzodiazepine, it crosses placental barrier. Done. Then another point somewhere it was there. Yeah, so you're very good in muscle relaxant. Inhibits polysynaptic reflex in spinal cord. This is also important. Then other important thing what you need to know is why is benzodiazepine preferred and not barbiturates. I've told you, and if you're able to recollect, it's really good. Told you the structure. If you're able to recollect this, I can tell you a clue. This was DI. Okay, so now that is done. Now looking at the adverse effects, we need to know that what is this. I'm not going to tell the name, but you're going to tell me what this is. If you have watched the video, you'll know what this photo is. Okay, and also the decreases respiratory depression, and I've told you it improves. I mean, there's less chance, but in case of labor, it is found. Okay, moving ahead, barbiturates also similar thing, and barbiturates, it can be used in neonatal jaundice. It decreases the bilirubin, right, serum bilirubin by acting on neonatal jaundice. So I told a Barbie, right, Barbie going in a GT. So GT is nothing but gluconyl transferase. Done. This is done, and it is a metabolism of bilirubin. Done. Okay. Now adverse effects I was talking about. It causes AIP, increases AIP, acute intermediate porphyria, and induces ALA synthase and catalyzes production of porphyrins. Okay, done. Now moving ahead, we have acute barbiturate poisoning. As I told you, hemodialysis and all those things. So it's acute barbiturate poisoning you need to be knowing. And then the shortest acting non-benzodiazepine, I think it's the third or fourth time I'm telling this. So it's Zaliplan. So in case you have been throughout this journey and do not think that we have finished, we have finished the main topics of sedative and hypnotics. So in case you want me to continue this, give a like. Okay, thank you. And next video I'll be talking. So this was a long video, so even I'm tired doing this. So it's really good if it has been useful and you have understood something. So really great if you have been through this hour. So thank you, and I'll be releasing another one whenever I get time. I'll be again making another video, and thanks for watching. And in case you have not subscribed, please subscribe. Yeah, thanks for watching. Bye. Wait, let me just write bye. Wait, where is the button? Okay, bye.